most patients that walk into a hospital will eventually have an IV placed. This is a task that can be completed by PCTs and nurses. There is a lot of skill and knowledge involved in the placement of IV catheters, and this video will demonstrate and explain the basics of placing an IV using the Insight AutoGuard needle from BD. When does a patient need an IV? In the past, the policy at Trinity Health Livonia was that all patients required IV access, but that's no longer the case. Since the implementation of the vascular access team and the availability of ultrasound-placed IVs and intraosseous access, it is always possible to quickly attain vascular access in the event of an emergency. So now, IV access is only required for patients that are receiving treatment through that device. IVs are used for things such as continuous fluid infusions, medication infusions, IV push medications, receiving contrast for imaging testing, or for continued access for blood samples. If your patient requires any of these measures, or anything else that utilizes IV access, they will likely require an IV to be in place. Peripheral IVs can be placed by PCTs and RNs. The vascular access team is also available to aid in placement, but they should be called only after multiple unit staff members have attempted to place a peripheral IV. The vascular access team is to be utilized to place the difficult IVs, not all IVs. Once you've identified that the patient will require a peripheral IV, supplies will need to be gathered from the pod room. You will need a transparent dressing. The best dressing we have available is the Tegaderm IV Advance, which also functions as a securement device to protect from accidental removals and displacements. But the basic small clear Tegaderm is also available in the pod rooms. A blue procedural pad. An appropriately sized IV catheter. Clean gloves. A tourniquet. Tape. A chlorhexidine swab, or if that is not available, alcohol prep pads. Sterilely packaged 2x2 gauze. A swab cap. Extension tubing. And 2 saline flushes. Before you begin, you should understand the supplies. The catheter used at Trinity Health Livonia is the Insight AutoGuard by BD. It is stocked in 3 common sizes. The size is printed on the package, but they are also color-coded. Blue is a 22 gauge, pink is 20, and green is an 18 gauge. The larger the number, the smaller the diameter of the catheter. So the 22 gauge is the smallest diameter, and the 18 gauge is the largest diameter. The AutoGuard is packaged with a protective cover over the needle. Remove it to reveal the needle, a white button, and the grip area of the device. I hold the catheter with my middle finger and my thumb and place the end of the device against my palm to stabilize the needle while placing. This is my technique, but there is no right way to hold the needle. Find what works best for you. The needle is hollow and beveled. This means that the tip is cut at an angle, resulting in one side being longer and providing the sharp point, and the other side that extends the angle is the bevel. Whenever inserting an IV, the needle must be bevel up. The point should be on the bottom and the angle on the top. This is easily achieved if you look at the white button on the handle. The white button is in line with the bevel, so if the button is on the top, the needle is positioned bevel up. The catheter itself is not the needle. It is over the needle. It is a flexible tubing attached to the colored hub. This is what will remain in the patient after placement. The actual needle will be removed. Because these are 2 separate pieces, it is important to make sure the catheter is properly seated on the needle before poking the patient. The company recommends you rotate the catheter around the needle until you feel it seat into place. When it is in the correct position, you can see a small raised ledge on the top of the catheter hub. This should be on the top of the catheter, and you will use it to thread the catheter off the needle once you've accessed the vein. And finally, there is the white button. This is how you activate the needle retraction. It is a safety feature to protect from accidental needle sticks. Once the catheter is in place in the vein, you will press the white button, and the needle will be instantly pulled back into the handle of the device. With supplies gathered, you'll need to locate the best site for this IV. Tie the tourniquet. It needs to be tight enough to slow the return of blood back to the heart and to cause the veins to swell, which means it needs to be reasonably tight. It should be mildly uncomfortable. If the patient can't feel it, it's probably not doing its job. The tourniquet should only be tied for 1 minute at a time. If it's been a minute and you haven't located a good vein, untie the tourniquet. You can wait 1 to 2 minutes and retie that arm to look again, or you can look at the opposite arm at this point. When the tourniquet is tied correctly, the vein should be easier to locate. Search the patient's arms for the best location. Tying tourniquets and locating the best sites are both explained in detail in separate videos. Once you've located a site, find a way to mark it, or make note of where the vessel is. You can use a sterile body marking pin to trace the vessel, or use freckles, moles, scars, or other landmarks to remember the location. Because after the site is found, you need to remove that tourniquet. and you may lose visualization of the vessel. With your site and catheter chosen, it's time to get to work. Use the chlorhexidine swab to clean the site. Chlorhexidine swabs can clean 1 square inch for every milliliter of fluid in the swab. This swab holds 1.5 milliliters, so it only disinfects 1.5 square inches, which means you clean your site, not the entire arm, with this swab. Disinfect by vigorously scrubbing the site back and forth for 30 seconds. Then you need to allow time for the CHG to fully dry. This gives you time to set up the rest of your supplies. Open the Tegaderm package, but don't do anything else with the dressing just yet. Open your sterile 2x2s and make them easily accessible. Open the catheter and the swab cap as well. Then take a look at the extension tubing. On one end is the adapter that will insert into the catheter hub, and on the other end is the needleless port that you would insert a syringe into if you were administering something through the IV. Open the package from this end, but don't open it completely. And don't remove the tubing, just expose the port. Then attach a saline flush and prime the tubing. We keep the tubing in the package so that it can act as a reservoir for the extra saline you push out the end as you prime. Keep the tubing in the package for now, to protect it from unnecessary contamination, and lay it with the other supplies. Return to your patient. Ensure the site is dry before continuing. If it isn't, it can lead to increased pain with insertion, and if the dressing is placed over chlorhexidine that isn't dry, it can cause a painful, itchy rash to develop. If the site is dry, retie the tourniquet. The area that you disinfected is now a no-touch zone. You cannot touch this area, or it will become contaminated, and you will need to disinfect it again before inserting the catheter. You can touch above or below the disinfected area, though. You can anchor the vessel in place by putting downward pressure on the vessel below the disinfected area. This can keep the vessel from rolling when you insert the needle. Always insert IVs aiming up the arm, never down toward the hand. Inserting down the arm leads to increased risk of clot formation, as well as poor delivery of medication from the catheter. Take the catheter and angle the needle about 15 to 30 degrees to the patient's skin. Any steeper and you will likely poke through the opposite side of the vessel very quickly. Any shallower, and the point of the needle may not be able to enter the vessel. Line the catheter up with the vessel. Poke the patient. As soon as the needle enters the vessel, you will notice blood filling the handle, and probably also the catheter itself. This blood is called the flash. When you see the flash, it means that the needle has entered the vessel. Stop inserting when you see the flash. Take a breath. The first big step is done. Next, you need to ensure that the catheter itself has also entered the vessel. The needle extends further than the catheter, so the flash will come before the catheter is actually in the vessel. You'll need to advance the needle and catheter a bit further, but before you do that, adjust the entry angle. Lower the catheter angle to become closer to parallel with the vessel. When you slide the catheter off of the needle, you want it to be able to slide in along the length of the vessel. If the entry angle is too steep, the catheter may get stuck on the opposite wall of the vessel as you try to thread it in, and this will impede the insertion. With the angle adjusted, just advance the needle another 1 to 2 millimeters. Then stop again. Now the catheter should be solidly inside of the vessel. Next, we are going to advance the catheter off of the needle and into the vein. And if you don't have the catheter in the vein already when you do this, you could damage the vessel as you forcefully push the catheter in, and that can cause the vein to leak, leading to hematoma and an unusable IV. So make sure not to slide the catheter off of the needle until after you have advanced the 1 to 2 millimeters after seeing the flash. Remember that small raised ledge on the catheter hub? Use your pointer finger and push the hub off of the needle using that ledge for leverage. While you are doing this, hold the needle steady. You are not advancing the needle, only sliding the catheter off of it. The needle provides a rigid structure to guide the catheter into the vein. A common mistake is for people to retract the needle after they have the catheter tip in the vein. But when you do that, the rigid guide is lost, and you will have issues if you try to push the flexible catheter into the vein at that point. Another common mistake is to advance the needle with the catheter all the way. When you do this, you will most likely poke through the bottom of the vein. Now the IV is not usable because it's not inside the vessel. You will see no blood return, and if the IV flushes at all, it will cause a lump to form because the fluid isn't traveling in the vein, it's being deposited in the subcutaneous tissue. When you appropriately guide the catheter off of the needle, you will likely see blood start to exit the catheter. Grab the 2x2s and slide them under the hub to minimize the mess. Then push the white button on the catheter to retract the needle. You do not need to remove the needle from the catheter first. You should push the button while the needle is still inside of the catheter. Once that needle enters the arm, there is no reason you should ever see the tip of the needle again. Retracting the needle at this point eliminates any risk of an accidental needle poke with a dirty needle. Then take the primed extension tubing. There is a white cap on the end of the tubing. Remove it and attach the tubing to the catheter hub. Twist it clockwise to tighten it over the hub. Remove the tourniquet. Pull back on the syringe to check for blood return. You should get blood return. It means that your catheter is still located in the vein. Then flush the blood back into the IV. You want to clear all blood from the tubing. If you accidentally pulled blood into the syringe, grab that second saline flush and flush with a clean syringe of saline. That way you won't be flushing with a mix of saline and blood, and you can be sure that your line is clear when you are finished. Remove the 2x2s. There will probably still be blood on the arm, and do your best at this point to clean that up before applying the dressing to the IV. Apply the dressing. Application of the Tegaderm and Tegaderm IV Advanced dressings is discussed in a separate video. With the IV in place and the dressing protecting it, you have successfully completed the IV insertion. Chart your IV placement in Epic using the avatar. So how long can it stay in? At Trinity Health Livonia, an IV can stay in place as long as it is free from signs of infection and it is still functioning properly. If you take care of an IV, flushing regularly, and always closing the slide clamp, IVs can last weeks. However, the dressing will need to be changed more regularly. If it ever becomes soiled or is starting to peel up, it should be replaced. It also must be replaced at least every 7 days. This is why timing and dating the dressing is so important. If you can't figure out when a dressing was placed, it needs to be replaced during your shift, and make sure you time and date the new dressing and chart the dressing change in Epic. Put all the used catheters in the sharps container. All other garbage can be in the trash or biohazard bin. The placement of IVs is something that will need to be completed for most patients at Trinity Health Livonia. It can't be done by PCTs and RNs. It is a skill that requires practice, so take the opportunities when they come, and don't be discouraged by failed attempts. Learn from them. Get better with every attempt, and eventually you will master the skill. It will save you time and hassle, and your patients will appreciate your dedication.